All right. Well, thank you, Leah, for being here. For those who
Absolutely.
I'm Erin. For those who don't know me, I've been a nurse in the state of Massachusetts going on 24 years. I'm also a freedom fighter, an advocate for my patients, and I'm very excited to welcome Leah Wilson, who is the executive director and co-founder of Stand for Health Freedom. It's a nonprofit organization dedicated to protecting human rights, constitutional rights, parental rights, and their aim is to educate citizens and lawmakers. The organization is pro-informed consent, pro-democracy, pro-debate, pro-informed exchange, pro-First Amendment, pro-science, pro-parental rights, pro-bodily sovereignty, and pro-conscientious decision-making. Lee is also an attorney passionate about children's health and has worked on children welfare issues for more than a decade. She's a former foster parent, and she was told that she was no longer qualified as a foster parent. And I think that would be a good place to start, Lee, if that's okay with you. Why you became a foster parent, why you were told you were no longer able to be a foster parent, and how that propelled you forward into the health freedom and informed consent movement.
Yes, of course. We can start there. My passion for foster children was initiated before I even went to law school because of some family circumstances with my mom's nieces, et cetera. And there were two primary issues that drove me to advocate for foster children and become engaged in the foster care system. And one was seeing hard to place foster children age out of the system without any grounding, without any belonging, and then they're expected to succeed with these Band-Aid services that the state offers them. So, and the second one was seeing the over-medication of foster children. In the US today, there are 240,000 children ages 2 and under on psychotropic drugs. What? And a huge number of those, 240,000, estimated 240,000, are in the under 2 years old. That's right, 2 years old. And a huge number of those who are on those drugs at such a young age are in the foster system. Like a disproportionate amount of our foster children are affected by this issue. And so seeing that just lit a fire within me to continue advocating for those kids, seeing them find permanent homes. We became foster parents ourselves. And then in 2018, we were up for relicensure of our foster license. And the state decided that we were unfit to be foster parents because our biological children are not fully vaccinated. And that like hit me super hard because my heart had been in it for these kids for the last decade. I had been through my own fertility journeys and had really just accepted that calling as standing in the gap for these less fortunate children. So that was super tough, just as hard as a miscarriage had been for me, was receiving that news. And it comes in the context of there are children in my state of Indiana sleeping on DCS's floor, yet I am unfit to be a foster home for these kids. And the decision was completely baseless because I fought it all the way up the chain of command. I knew it was baseless, but I wanted them to speak for themselves and to defend the decision that they had made. And no one could show me any scientific evidence that these kids are threatened by my unvaccinated children. No one could show me a law that had changed or a rule that had been written. It was simply that a bureaucrat in the state had decided to interpret the existing rules differently to now consider unvaccinated children to be a threat to the well-being of foster children. So because of that, after fighting it as far up as I could within the state of Indiana, I decided that it was too big to fight and too big to walk away from. So I started covering vaccine issues full time and just diving deeper into this outside of our natural health education that we had already, my family owns a natural health clinic, one of the largest in the Midwest. And so we were already big into the natural health world and into lifestyle medicine. So I took that passion along with my passion for advocating for kids and started Stand for Health Freedom so that we can stand in the gap, not just for our foster kiddos now, but for the future of every single child in America, because I truly believe that bodily sovereignty and the ability to raise our children in the way that we see best fit is the most important issue facing us today.
It is. And you founded the organization with, and I hope I'm saying this right, Sayer G, who is Green Med Info, and then Dr. Joe Bohemier.
Joelle Bohemier, yes.
Yes. Okay, I'm gonna make sure I'm saying those correctly. So I wanted to go straight into your interview with Vera Sharav because it's all related. And for those of you who don't know, Vera Sharav is a Holocaust survivor and human rights champion. And Leah had the amazing opportunity to sit down with her on a 2-part series and talk with Vera. And I'm going to put a link in for everybody to watch that. I think it's such an important issue. And what struck me in Vera's presence was the urgency in her voice, the sense of warning, kind of like, she's holding the red flag warning, been there, done that. Let's not repeat. Let's not have this repeat. Book page, Leah, you put a quote of hers up, and I'm going to read it. And it says, you need to think very, very hard about, is it the right thing to do to obey authority? Because these authority bear absolutely no responsibility. If your child is harmed, the only one who has responsibility is you. Do you really want to play Russian roulette with your child's life? Why did you feel compelled to put that specific quote up on your Facebook page?
Yes. Many of us can feel now in a real way that there is a one-size-fits-all way to take care of your body being pushed upon us. And that in a huge way includes mandatory vaccination. Mandatory vaccination has been our primary tool for caring for the health of our children in America over the last several decades. And it's our primary tool for containing infectious disease now, as we're watching on the world stage, as we bring new vaccines to market in order to save the world from an infectious disease that is now covering every headline in the news outside of the election. So when I went to visit Vera, one of the most important messages that she carries, it stems from her childhood of being 6 years old and being told that she had to get on this boat. And the boat was going to be full of orphans that had been rescued out of these camps where she had lived for 3 years with her surviving mother. And she had a sense of check within her gut saying, no, I don't want to get on a boat full of children. I don't feel safe about that. I want to stay with these adults that I've just met on the train. So she resisted getting on that boat with everything in her. She screamed, she yelled, she refused. And that night, the boat was attacked by a submarine and the children perished on that boat. And she knew that she had saved her own life. And as she grew up and studied what she and her family had gone through, and then had her own experiences with lack of informed consent with her own children, it became very apparent to her that the issue is blindly following authority, that we are blessed and gifted with thinking minds, with intuition, with instincts, with religious beliefs, with family support, and all of these things we're being asked to ignore to follow one industry, because it's an industry's guidance, one industry's authority. And we all need to be asking ourselves, are we asking the right questions? Are we staying true to what is in the best interest of myself and my children, my community, my business? And if we can't answer those things, yes, then it's time to do a deeper dive and realize that we are at a crossroads and that we are the only ones that will be accountable for the path that we take. We're the only ones that will be holding the broken pieces if we participate in an intervention or in a medicine or in a protocol that has side effects or that creates damage to our bodies or our business or our homes.
And also found it very interesting that Vera said that in today's world, if a child would refuse to get on that boat or refuse something else and have a temper tantrum and absolutely put their foot down and say no as a 6-year-old, they would be labeled as ADD or, like a defiant disorder and put on medication. Mm-hmm. But because of her intuition, even as a 6-year-old, because of her behavior, because she stood her ground and said no, it actually saved her life. So you're right, kids are over medicated and we need to approach them a different way. It's a challenging world we're living in right now.
Yes, and in Nazi Germany, all medicine ended up becoming public health. And that's what we don't realize is that under that regime, it's a regime like most other dictatorships we can study in world history. It was governed by constant fear and constant surveillance and promises of safety and security. And so that's what all of the liberty, all of the individualism was being traded for. And it was being governed and ruled by public health. The majority of the actors within the Nazi regime were in these concentration camps were actually medical personnel. And so we fail to appreciate that when we see the writing on the wall, it merits a second look and it merits us being willing to confront things that feel too dark to confront. Comparing our own reality to Nazi Germany doesn't feel right. It feels as if we'll wake up from a bad dream or that we'll be labeled conspiracy theorists if we dare to look into that. However, as a thinking person, it's important that we confront the brutal facts and make decisions that are going to position us to raise our children in a way that allows them to thrive.
Right, correct. And I'm in Massachusetts and currently fighting the flu shot mandate, which Governor Baker says a child as young as 6 months old, all the way up to college years, needs to get the flu shot by December 31st or they get kicked out of public school. And even if they're fully remote, they're forced to get the flu shot. But the teachers are not mandated. Not that I want the teachers to be mandated. I absolutely don't believe in that. It's a fear-based mandate because he's saying he wants to prevent the hospitalizations and the twindemic with the flu and the COVID coming together and to overwhelm the healthcare system. And he also said that the children have to protect the staff and the teachers. So now it's the children's job and the children's responsibility to protect a grown-up and adult. And it's also almost like a guilt thing. It's the child's responsibility to protect somebody else. And that's their public health policy right now. And it is based on fear, but it starts with the children. And there's lawsuits. I think there's 2 lawsuits. They're going to lose. And I think that what people would want to know is what should parents do? And I pulled my kids out of public school. I have 2 boys in elementary school because of the mask mandates. And I'm not going to give them the flu shot. So I think for people that are watching, if you have any answers for them, what would be your advice for a parent going through this right now?
Yeah, it's a good question. I think that a lot of parents are starting to ask that same question is what if I'm forced and what do I do? And we have to be willing to help them walk through the hard decisions because we can't make guarantees for them. The government's claiming to make guarantees that you can protect others and save others. However, we know that anyone who knows anything about health knows it's a personal responsibility. No one can do health for you. And you can't do health for anyone else. It's a false bill of goods. It's a false promise to say that I can protect you when the majority of things that America is going through right now are immune system issues. So how do you build your immune system? I cannot do that for you. And to promise that for you is a false solution. So helping these moms pace through and have the courage to make the hard decisions of not participating. You know, and you've made the hard decision for yourself. I'm sure that it turned your household upside down to change how you educate your children. We have made some changes in our educational format this year in response to government mandates. And I still have help with my children's education, but it puts more of the responsibility on me as a primary educator, which is hard. It's tough. It's a new mindset. It's a new, it's a whole new vision, you know, for our families and for our children. However, when we opt out of things because of our ethical, moral, religious convictions, then we are not only doing that for ourselves, we're doing it for our future generations. Because if we don't hold back the tide now, then that standard will be set that it's acceptable to mandate unnecessary, ineffective interventions for the greater good. And so these moms who are facing these decisions, I think that they need to be vocal on a local level. And we always teach our advocates to be vocal in a way that people can join the message with you. Right. So we don't show up angry, we don't show up damaged, we don't show up frantic, even though that's probably what we feel in our inside sometimes, but we show up confident that what is happening is wrong. And we have a voice to say, hey, I'm concerned and here's why. You know, I'm concerned, has it ever been shown to be effective or safe for my child from 6 months to age 19 to receive a flu shot every single year on the year? 19 consecutive flu shots. Can you show us that's safe for our children? I'm not okay with it and I won't participate. And when there's enough,
it's safe on their schedule. You know, we don't know where every child is on their immunization schedule. Is it safe to be put, you know, with the MMR? Is it safe to be put with any of the other ones? And should they wait a week? Should they wait 2 weeks? You know, there's just too many unknowns.
And we've seen the CDC respond to questions like those. And we as mothers have to decide whether their responses are adequate. For example, there was I believe it was last June, a new adjuvant was being considered in front of the CDC's committee called ACIP. And they asked, okay, we have this brand new adjuvant. We're going to vote to see whether or not it can be approved for the childhood schedule. One doctor questions, has this been tested in combination with the other adjuvants on the schedule? And the response was, no, but we don't recommend you give vaccines. We do recommend you give vaccines at the same time, but in different limbs. So that was their response. And then the next doctor raises their hand and says, have any other countries been using these adjuvants in combination? We don't know, was the answer. Third question, what about the 14 cardiac events we saw in the trial with this new adjuvant? And the response was, we will wait and see post-market. Put the adjuvant up for vote and it voted unanimously to be put on the schedule. And so that's the CDC's answer. They gave it their stamp of approval.
Yep, people understand that when you give different injections in different limbs, it goes to the systemic system, no matter where you put it. So I can't even believe a professional person would have that as an answer.
Like it's a site-specific injection, right? To protect against infectious disease. Right. I shouldn't laugh, but it's just sometimes you have to have some comic relief to say our moms deserve better than that. We deserve better assurances that things that are stamped by our regulatory agencies have gone through some due diligence. So, you know, just bear in mind that as you ask those questions, you might even already know the answers, but we have to encourage people to be asking the right questions, model the questions that need to be asked. A lot of people haven't thought about these things. They haven't had reason to think about them. Unfortunately, where people think about these things is once they've hit crisis. And so you can be a lifeline to the next person of saying, there are a few considerations you need to make first. And as for me and my family, we're going to stand firm and hold this line because we know that it's important.
And on that note, could you explain what is informed consent and what is it not?
Yeah, it's a good question. Well, first of all, if you go to the CDC website, I can even send you a screenshot of this. It would be helpful. On their vaccination page, it says the CDC does not require informed consent for vaccination. That is the federal standard, and state and local authorities are allowed to pass stricter laws. So the CDC has said that. Sometimes federal regulations will say they're preempted. You cannot pass stricter laws. However, in this instance, you can, but the CDC is a standard bearer. So informed consent, not required for childhood vaccination. But when you go into a doctor's office, whatever type of provider it may be, and they offer you a solution to a health problem, you must first know what the risks of your health problem, of your diagnosed health problem, which in the instance of vaccination, it's preventative. So you could look at, what are you preventing? What are the risks of what you're preventing? What are your chances of getting it? If you did get it, what might be the outcomes? And then once you understand what you're up against with no intervention, then you should be given the outcomes of with the intervention. So with the intervention, you could have this outcome or you could have this outcome. And so you should know both the positive and the negative of any given medical intervention.
Right.
So you should understand fully what your options are, what happens if you do nothing, what are the chances of that, and what happens if you do what they're recommending. And that's what informed consent looks like. And I'm sure that many of you have heard over the last couple of years as measles hit the world stage right before all of this COVID pandemic. And people were saying, like, what is the risk of measles for a child in America? For a child that has access to proper nutrition, access to proper sanitation, and what is that risk of death? How remote is it for my child? And then what is the risk of an intervention? And so that's informed consent, is fully understanding why it might be necessary to intervene and what it looks like to intervene.
I've never heard of, you don't need informed consent for a vaccination. Is that?
I can send you the slide. It's on the CDC website. And that's why the VIS statements were created. So, the vaccine information sheets, they're one-page sheets. And
Right.
that is what is required to be given to someone at vaccination, is just that sheet. And so it's kind of a replacement or a watered down form of informed consent. And then the CDC made that statement, and it's all under the guise of, vaccination programs started in the arena of the Department of Defense. And so when you look at protecting our nation from biological warfare attacks, from the spread of infectious disease, that is what the vaccine program was built upon. And that's why they have different standards for the licensure of these products, for the consent that has to come with these products, for the mandates, for the liability, et cetera.
All right. Well, on that issue, do we actually lose our rights during an emergency?
It's a good question. What are we seeing happen? Do you feel like you've lost your rights? Do you feel like you still have the freedom to assemble and the freedom to speak up? And do you feel that you have a voice on any public medium possible? Do you feel that your lawmakers are listening to you? There is no emergency exception to the Constitution. The Constitution was written during a time of crisis. It was written during a time when our nation needed stability. And what they did was they signed that Declaration of Independence, signed that Bill of Rights, that Constitution, and gave the authority to the people. And when that was signed, it wasn't a guarantee for me and you. The only guarantee in life is change, right? And so we oversee that change. And that's why our activism, our voice is so important, because there are constitutional rights in America. There are not emergency exceptions to them. However, we oversee the change. And right now we are making history. our children, our grandchildren will use what we're going through today as a reference point for what is or is not acceptable. You know, heaven forbid we experience an infectious disease outbreak of 30% like we did with smallpox. What then when the current outbreak is an estimated 0% fatality rate for our children all the way up through the age of 50, it's negligible. And then once you hit 50, it's 0.5% of the CDC says 0.5% of fatality rate. So if we use COVID as a reference point for what we experience in the future, what does that mean? We have to appreciate that we are literally overseeing making history. And Jacobson, the 1905 Supreme Court case, is what everyone points to say the state has authority to require you to act in certain ways. Well, Jacobson was 1905. It was pre-civil rights era. So this Supreme Court decision came out during a time when women did not yet have the right to vote, when Rosa Parks hadn't done what she did for civil rights, neither had Martin Luther King, the freedom rides hadn't happened. You know, so all of these, we've made all this progress with civil rights, with individual freedom, with not discriminating based on gender, based on race, you know, and so now to say we're going to discriminate based on your religious beliefs or based on how you care for your body is a huge step backwards in society. And smallpox was the disease in question with Jacobson, which was a 30% fatality rate, as I mentioned. And we need to be able to show that there's no alternative and that it's absolutely necessary to intervene in this way. And that's just not been shown with what we're currently experiencing. So there's no doubt that society is under a great deal of stress and pressure right now to show what will we tolerate as it relates to having our freedoms stripped.
Right. So speaking of society, so there's so much going on, as you know. Like I said here in Mass, Governor Baker mandated the flu shot. You know, we're not supposed to leave our house from 10 at night till 5 in the morning. New Jersey, I guess, wants to mandate the flu shot. You know all about the horrible DC bill that they're allowing children to consent to vaccinations. California universities requiring the flu shot. There's a lot of people that, because I've been using my voice, I'll just get messages, you know, thank you for all that you do. I'm staying silent, but I'm watching what you're doing. What should the average person do? You know, there's a lot of people watching. There's a lot of people sitting back. Is it just the activist job to take all the action while others kind of sit silently back? And, what should they be doing? What can they be doing? You know, they're watching, they're not sure what to do. Maybe they should speak, maybe they shouldn't. Maybe they think it's, someone like it's your job and they're just going to let you do it.
Yes. So we hear that all the time. Well, I'm not an activist. Well, my stepdad's not an activist. Well, you know what I mean? Whatever it may be. And I can appreciate that. I get it, that it feels overwhelming to speak on complex issues, to speak on issues that society has led you to believe require a medical degree or a science degree or a legal degree, which is all false. We have to reject those things. This is the people's fight. We don't need a white coat to understand our Constitution, to understand what we feel in our heart of hearts is best for our communities, for ourselves, for our children. And so we first need to reject the complexities of the situation because it is of the enemy to confuse us. Confusion is an art of the enemy, and we don't have to buy into the scientism and the legalism that our voice means nothing. So even if you don't understand the science or understand the latest headlines, if you feel that something is wrong, you speak up and you say, I don't like this because it's affecting my child in a negative way. With this e-learning, so many moms aren't reporting back to their principals, to their school districts, to their school boards, their local school boards, or their public health departments, or their city councils, how negatively this is affecting their children. that their 10-year-old had now for the first time has depression and anxiety and it is not progressing in their schoolwork, that their 15-year-old's coming home with daily headaches and they never had a headache before being required to wear a mask. That if we stay silent and we don't make our voices heard on these issues, then we can't expect to see things change, because we don't have the industry's tools and money. So this is the people's battle. This is the people's responsibility to gather and show our numbers. And that's why we created Stand for Health Freedom, was because we know that not everyone can show up on the Capitol steps, especially today. Is your Capitol even open? Who knows, right? So we know that not everyone can show up. We know not everyone feels capable of drafting an entire email that will be taken seriously. So we made it easy for people to click to take action, and then they can customize as much or as little as they want to. Customization of any email is suggested because it makes it more personal and effective to your specific congressman or state representative or city representative. So that's why we built Stand for Health Freedom, because we know that in order to push back the industry's agenda, we're going to have to show our numbers. And showing our numbers is a big deal. And we can only do that if we decide to stand together. So we saw this be effective in New Jersey at the beginning of the year when they tried to take away all religious exemptions.
Mhm.
At one instance during that battle, which we ended up sending pharma home empty-handed in a state that has 14 pharmaceutical companies, we had 80,000 emails sent within 4 days. And so giving people the power to stand up with a message that has nothing to do with your personal choices.
Mhm.
It's not about whether you choose to participate in the vaccine program partially, fully, or not at all. It's about the parents having a natural right to say what is best for their children. It's about the individual being able to say no to something without having to justify it, but simply because they know what is best for themselves. So that's why Stand for Health Freedom exists, is because we know it's not feasible for everyone to show up, but we know the numbers are there. The people are there. The people want to have their questions answered, and they're peeking in and they're asking questions, many of them for the first time. So 2020, I think we have grown our advocacy base across the US by 2/3 in 2020. That means 2/3 of advocates took action for the very first time this year.
So that's something they can definitely do in the background.
Yes, and just using your voice, even if it's just to say, this is what I'm seeing with my own child or my own job or my own company, those concerns have to be brought up. And if we are diligent about bringing our concerns and in a way that they can see themselves in a kind way where you're making friends and influencing people, I'm not asking you to beg your representatives for things, but I am telling you that if you show up in a way that they can hear and that they can share with their peers, can they be proud enough or confident enough to share your message with their peers? And that's how we're going to make a difference, is if they hear from enough of us that this is what the people want and this is what the people need.
I want people to understand the meaning of the greater good. And why should somebody wear a mask or not, to protect somebody else? Or the idea that I need to get a vaccine to protect everybody else, or I need to vaccinate my child to protect your child. Can you describe what people mean by the greater good?
Mm-hmm. So going back to where we first started to see for the greater good was Nazi Germany. You know, it was for the folk. There they use the term for the folk. And the concept that I make personal health decisions based on the population, or we have population-wide standards, that literally means that we no longer work in tandem with the Hippocratic Oath, with first do no harm, with what is best for the individual patient in front of you. And for many of you, that rings a bell with sanctity of life issues. So if we're sacrificing some for others, then we are treading on sanctity of life in a big way. So what we have to realize is It's impossible to harm an individual and for that to benefit the whole, because the whole is made up of individuals. I have a hard time thinking of any way that for the greater good holds water. I mean, someone write in, make a comment on this video, email us and tell us, like, where have you seen for the greater good be a genuine effort where it doesn't require the sacrifice of individuals, which then ultimately hurts the whole. So we've seen it before. It's not the first time we've seen it. And it requires the disregard of the Hippocratic Oath of first do no harm, of honoring human rights for the individual.
I know I've talked about this previously in my other videos, but the Maslow's hierarchy of needs. So you start with psychological safe, then you go to safety, belonging, esteem, and self-actualization. With children right now who we're raising, we can't see their face. They're fearful, they're more depressed than ever. We're robbing them of childhood, they're isolated. And I just want to talk about their basic needs as related to what I learned in nursing school, the Maslow's hierarchy of needs, and how it's being taken away from them.
Mm-hmm. We have, our society is being governed right now, unapologetically so, by public health. And when you give all of the power to public health officials, they're taking the tools that they have under the microscope that they use on a daily basis and making population-wide decisions that have a holistic effect. So if you're only looking at, 1/8 of the picture and making decisions that affect the whole picture, then we have a lot of cost that are not being considered. And with Maslow's hierarchy, I think that, as people have crisis in their life or they dig more into holistic health, they understand that mind, body, spirit are inseparable and that one can't thrive without the other. And a lot of people, a lot of doctors, scientists, spiritual leaders believe that mindset is first, that sense of community, that sense of belonging, that peace and stability is the foundation for all other abilities to succeed or thrive in life. And if we're governing with fear, our children are now so afraid of germs, they probably all have OCD by this point if they're out in public for any amount of time at all. So if we're governing with fear and we're governing with separation from our community, then have we taken away that solid foundation from our children? And I was talking to Dr. Bregan, and it really hit me hard, Dr. Peter Bregan, when he said, our children need to know the truth, that they are a gift to society, that them wrestling with these diseases where they have like 0% of fatality is actually a benefit to all of us, and that they are the superheroes. And just turning that narrative on its head to see what are the possibilities? What could we make of this instead of what we're seeing with governing with fear and separation and judgment and bullying. I mean, how many years have we spent on anti-bullying campaigns? Right. And now we're teaching people to bully. We're teaching them to yell at each other if they don't have a mask on, or to tell them that they're going to kill others if they don't fall in line with any specific procedure. And so just really being aware, we made so many strides, so to speak, in mental health, awareness of depression and addiction and suicide. And we're throwing so much out the window with this microscopic vision of stopping the spread of an infection that has a very low fatality rate and targets a very specific part of our population.
I want to believe that our governors are coming from a spot of compassion, coming from a place of understanding, of coming from a place of looking at both sides. I'm just losing faith, I'm losing trust, and I know a lot of people are too. What do you think has happened to our governors who are putting out these horrible mandates? I mean, are they being threatened? I mean, what is going on?
I'm sure there's different situations for so many of them. You've seen there was a video, was it this week or last week, of a leader in Canada just full on crying, saying, I'm forced to steal Christmas from you guys. I'm so sorry. I'm the one that has to be the bad guy. And he's like in full on tears on camera. And you're thinking, wow, this guy really feels like he's doing what's best for his community, perhaps. But on the other side of it, you have to believe that the information is out there if they care to look for it. Like, how long can we claim ignorance? And then I want to present you with a third side of that. And that is, we should assume people don't know unless we tell them. You know, if your governor hasn't heard from you, hasn't received an email or a letter or request for a meeting talking about, like, look at the Great Barrington Declaration, look at the Pfizer trials, they're scaring me, I don't think this is right for our community. If your governor and your state legislators haven't heard from you and your city council hasn't heard from you, then you can assume they don't know, right? And so, I mean, look at the mainstream media, look at the news sources, and many of these gentlemen and women are briefed by someone, and that's their source of information, is whoever briefs them. And so if you can be a resource to them, if you approach it in a way of personal experience, of data, of science, you know, we don't approach this in a way where we're sending them headlines or other articles. No, we go to the source of that article. We go to the source of our belief or finding or conviction. And that's what we take to them, is the raw data and the information that they need to see. I mean, there was an FDA briefing released today on this Pfizer vaccine. And it says in there that there is adverse events up to and including death in these trials from this vaccine. So we need to be taking that to people in positions of influence, including our employers and including our elected officials.
And hope for the best.
Right. Hope that, you know, that the destruction is minimized, you know, that we, that people are afforded the decision that they deserve, and that the destruction is minimized, because we can't control people's decisions, and that's not what we're setting out to do. But to protect human rights, to protect civil rights, you know, people deserve to be allowed to participate in society without being judged based on their or discriminated against based on their vaccine status, based on their health status, et cetera. I mean, children who have Hep B are not excluded from school, but in some states, if they don't have the Hep B vaccine, they're excluded from school. And so, since when are we going to stand by and allow our civil rights be infringed upon in the 21st century?
Right. Leah, we just have a couple minutes left. Could you just give some final thoughts and let us know where people can find you?
Yes, thank you. Stand for Health Freedom. So all written out, standforhealthfreedom.com. So you can go there on your browser, on your phone, and press join so that you can follow our alerts and have the opportunity to take a stand in your area or on a nationwide basis. And also on Instagram, Stand for Health Freedom, Twitter, Stand FOR Health 1. You can find us on all those portals. I strongly encourage you to get on the email list, though, because social media is not dependable form of communication, as there is one accepted narrative across those platforms. So if you can get on our email list, that's the best way to keep in touch with us. And two actions I would like everyone to take today as they're watching this. One is to go to the No Mandatory Coronavirus Vaccine campaign. It's under the National Action Alerts, and send that letter to your governor and to your state legislators, asking them to take notice of the reasons why this intervention must be voluntary. And then the second is to go to the DC campaign, asking Mayor Bowser to veto the bill that the council passed. So the DC council passed a bill to allow the state and the educational institutions and the healthcare providers to have access to our children starting at age 11 to vaccinate them with any vaccine on the ACIP schedule. And so we know that once this coronavirus vaccine gets any sort of licensure from the FDA, it will go to ACIP within what I've heard is 7 days. So if that experimental vaccine comes to our childhood schedule, That bill would allow access for an 11-year-old to make that decision without their parents' knowledge or consent. And I say knowledge first because that means that this fact of vaccination be concealed from the parent. And get on our Facebook page and listen to what the experts are saying about the dramatic effects that can have, not only on the child's physical well-being, but on their mental health, on their relationship with their parent, on their long-term success. So take those 2 actions, get connected up with us on StandForHealthFreedom.com.
Leah, this is such important information. We're in a really critical, scary time right now. Everybody appreciates what you're doing. I thank you so much for your time. I have some final thoughts. If you let others do your thinking for you, you simply give up your power. You give up who you came here to be. You cannot contribute to the world if you allow others to do your thinking for you. What you end up doing is supporting that person's ideas, their agenda, their goal, their outcome, and not your own. We are at a critical time. We all need to make a choice. Stay silent or stand up for you and your child's right. This video will be posted on YouTube. Erin McDermott, I've already had 2 banned videos, so I don't know. Oh, I can't post on YouTube for a week, I'm sorry. I'm gonna try it on my Facebook page at Erin Finn McDermott. It's on Instagram at The Ethical Nurse and BitChute at Erin McDermott. Leah, thank you so much for fighting for all of us. I'm going to continue doing what I do. I'm going to continue following you. Thank you again for your time.
Thank you. I appreciate you.